we going to share stories as patients and clinicians who are working together to make a difference for others?
Every year, great ideas come from the Innovation Symposium. We needed to begin the week with the major thing that we're focusing on, and that's our patients and families.
Because families are actually integral to a patient's outcomes.
So on Boxing Day 2002, I became a little sicker, and 2 days later I was diagnosed with a massive brain tumour. I was 8 months pregnant. I'm not standing here saying I can fix it all, but what I am saying is we can lighten the load. We can help people. We can hold their hand. It doesn't take much. Just smile. Help that positive attitude.
That little boy taught me more about leadership than all my time in emergency services. Over the 8 years that Samuel survived after his non-fatal drowning, he was hospitalised nearly 70 times. And I can reinforce the things that you've already heard, about how security interact, about how the car park attendant interacts with you when you arrive, about how you coordinate the multitude of appointments that are required.
This concept that there are factors in patient care other than having symptoms relieved and living longer is important.
I had a life-saving, life-changing bilateral lung transplant on the 18th of October last year, and I'm 47 years old. Since that day, it's not me, it's we.
Rehab's sort of got the scientific base behind it, and then I suppose it's the way you run it is slightly different from each program. So I try and set up not just a goal-centred relationship, but a bit of a personal relationship so that I can find out as much as I can about that person.
The actual doing is important. The practicalities, the examples that they've given are really, really important for staff to absorb.
I guess it's helped me to think about ways I can make the meetings that I run better for families, really.
And also it's very important to contribute to the hospital system. And everyone is equal living on this planet, and we should have the same equal treatment.
A cultural shift, I guess, doesn't happen overnight, but it's encouraging that it is being recognised, and that's where we're working towards.
And what I can see is that you are all people who are really invested in this space of patient experience.